got a very strong recognition and the grant we got for IIHMR University. So on behalf of my esteemed panelist team, Dr. Vishal Beri, CEO, Hinduja Hospital, Mr. Salil Kallianpur, CEO, ARKS Consulting and Digital Brand Coach, then Mrs. Nidhi Goel, Director, Healthcare Analyst, Anthem US, Mr. Niladri Majumder, Manager, Clinical Data Analyst, and Professor Marianne J, Change Maker and Visiting Professor. So on behalf of these esteemed panelists team, a very warm welcome to you all, my dear participants. So let me give you a brief intro of our esteemed participants. Dr. Vishal Beri is not a new name in medical fraternity. He has got an esteemed credentials also, as he has attained medical education from State GS Medical College and the TN Medical College in surgery. He did his master's in management from IIHMR Hyderabad, and he's a seasoned CEO with considerable experience of working in the hospital and healthcare industry. He has a unique blend of being a postgraduate clinician armed with a formal management degree, which makes him well suited to handle the needs of the dynamic and ever-changing business environment. Mr. Salil Kallianpur, he is the CEO of ARKS Consulting and Digital Brand Coach. He is a pharmacy graduate, has around 2 decades of pharma industry experience with leading multinationals like GSK, Pfizer, Novartis, and the Dr. Reddy's, and that we are a very senior and strategic business leadership role. Today in digital space, Mr. Salil is the most sought after person, and he's an advisor and mentor to many business organizations for digital transformation. Mr. Niladri Majumder, an alumnus of 2006-8 batch from IIHMR Jaipur, he is a seasoned healthcare informatics professional and entrepreneur with a passion for transforming healthcare through technology innovation and data analytics. Over a decade of experience working with finest academic medical centers globally, which has helped him to achieve greater heights in better patient care through digital health strategy implementation. Ms. Nidhi Goel, our alumnus of 2005-7 batch from IIHMR Jaipur. Currently, she is based out of New York, US, and working as a Director of Clinical Information and reporting for Anthem INC. She is a proven business leader in healthcare analytics and clinical strategy, and she has got a global experience in developing clinical analytics-based member or provider management strategy, cost of cost savings intervention, performance management reporting, healthcare strategy, hospital and health insurance data analytics, and assisting in onboarding new partners. Professor Marianne Frazen is the founder and director of Frazen Partners, the Netherlands and India, studied social sciences and business administration, specializing in organization and psychological issues. And in 1983, she founded her own consultancy, interim and training firm in innovation and change management. So this was a brief intro of all our esteemed panelists. Again, a very warm welcome to all the people who have joined us for this webinar on behalf of esteemed panelist team and IIHMR University. So let us start our webinar, that is artificial intelligence in healthcare domain. Now, let me ask the first question from Dr. Vishal Beri. Sir, in my knowledge, there is a very long list in which a hospital can undertake using artificial intelligence. So, can you let us know, sir, that which are some of the common areas where in your hospital artificial intelligence is being used, and what is your experience in the same?
Sure. So, good evening to everyone. Now, let me take advantage of the fact that I am the first speaker, so I can starting with what exactly is AI. So, of course, I think all the other panelists are probably going to be much more well-versed and give much more technical definitions of AI. But the commonsensical definition is basically it's the capability of a computer program to perform tasks or reasonings processes that usually we would associate with intelligence in a human being. So put short, just like the brain of a human being would do certain complex tasks, this is a software or a program where a computer is actually end up going to do those things. So with that is what AI is. Now, AI, I think, can impact lots of industries across the spectrum. It can impact any industry, you name it. But the interesting thing is that each industry is not suited to being transformed by AI. So if you look at different industries, there are certain industries which are much more amenable to being transformed by AI. There are certain industries which are less amenable. Now, in that spectrum, if you look at where healthcare is, so there was an interesting study which was done by McKinsey. So in that, healthcare is at the lower end of the spectrum. So simply put, that says that in the healthcare industry, you can't really automate the entire process end to end. There's only a part of it that can be automated. Now, what part of healthcare can AI impact? So this study basically said that what share of time or what share of the processes which are being performed in that sector can be impacted by AI. So in healthcare, basically it's just about 35% of the time spent can be actually automated. And interestingly, again, within healthcare, not all processes can be impacted to the same extent. So again, at one end of the spectrum, you have, let's say, a medical device production and things like that. There, the automation can go up all the way to about 48 hours, which can be saved on an average. And at the other end, you've got nurses and chiropractors where it can only be 2 to 3 hours. So it is that varied, the impact with healthcare AI can have on the healthcare sector. Now we've seen what AI is, we've seen what the impact can be on the healthcare sector. Now within the healthcare sector across the geography, across the globe, again, we see variations in the amount of impact AI has had. So India has as I think all of us would know, India has a unique set of challenges. So I just want to share a few data points which would put that in context. If you look at the overall healthcare sector in India, I think everyone is well aware of what those numbers are, but we are really far lagging behind as compared to the developing nations. So if you look at almost all parameters, the percent spend of GDP, we are at about 1.3%, hoping to go to about 2.5% of GDP, which is way lower than what developed nations are spending. Similarly, if you look at what a developed nation like the US is doing, it's doing about 16.9% of GDP. So we are way below there. If you look at any other parameter like the spend in India, 65% of healthcare spend is out of pocket. This is another big pain point simply because the insurance penetration is very low. Again, if you look at the ratio of doctors and nurses, India is way behind even the WHO standards, not only developed nations, but also even developing nations. So India's the ratio of doctors for beds is about 1 to 10,000, whereas it should be about 1:1,000. So we are tremendously short of doctors. We are tremendously short of nurses. So we are actually battling with, if I may use the term, third world problems. So in a scenario like that, is AI really an overkill, or is AI something that can really impact the healthcare industry? So basically it can. And in India, again, we are seeing a lot of impact. So in the hospital setting, let's probably, we could quantify it into 3 different levels where AI can actually see its application. So the first is probably the lowest rung, like we would call it the low-hanging fruit. So these are routine and repetitive and largely administrative tasks which happen countless times each day. So these are things which are probably most amenable to being impacted by AI. And also that's where the easiest. So that's one of the first steps where you can. As the next step, we would then look at maybe a shift which is happening now, a shift from hospital-based care to home-based care. So what that does is that you actually avoid the necessity of the patient to having to come to the hospital. There's a large amount of the share treatment which can happen in the patient's home. So today we are seeing a lot of these care at home so-called concepts in numerous companies which have come up in the last few years. And this is where they can impact. So AI has a big role to play there. And then at the other end, which is the third and the highest stage of evolution, would be where AI forms a part of your actual clinical decision making. So we call it these decision support softwares and things like that, where clinical trials, and actually it helps the doctors and the end team to take real decisions. So if you were to break the impact of AI into these 3 segments, I think overall in India, we are still at the first and maybe somewhere around the second stage. There are very few examples where we've actually gone to the third stage. So one reason for that is that our healthcare industry is very fragmented. So you do not have real large superarching companies, for example, or the government which has such a huge network where the impact of AI can be spread across numerous units. So if you look at large hospital groups, I think the largest in India currently would be around 10,000 odd beds. So that's still fairly small if you were to compare the overall number of beds in the entire industry. So that's the reason where we don't really see an overarching impact. So if I was to give an example of our particular hospital, again, the use of AI for us is again limited to the first segment, which is these routine administrative tasks. So a few examples in that is, of course, like we know, radiology is one department where there's a reasonable amount of application of AI. Then you have the administration. So whether it's your claims processing, today we use a lot of software and machine learning for automating claims. So earlier, conventionally, what would happen is you would actually send a patient's bill every single time there was an update. You would send it, fax it to the insurance company. The insurance company would, in an offline mode, then approve or say whether it's okay or not. Today, we've got programs which can actually automate a lot of that stuff. So you don't really need to keep sending documents to and fro. The software picks up, and at the insurance end as well, they are able to, so anything that's fairly routine and usually a part of most bills and within the range, no one questions those things. The moment there's something that is out of the ordinary, that's where a question would come. So those routine tasks are again where AI is being used. And of course, limited extent, we use it in projects for whether it's the utilization of our OR and operation theaters, improving the discharge time of patients. So, but that piece is, as on date, it's still only project based. It's not really tested and implemented across the organization. So in short, we are still in the first and second stage of adoption of AI, and we are yet to use the full capability of AI simply because it's a new and it's evolving concept. And as healthcare, we've always been a few steps behind other industries. So if other industries would probably adopt it, like your e-commerce, which all of us are used to today, every app is on the phone. Every app is using AI to some extent. I think as healthcare, we are still a few steps behind, simply because it's much more technical, it's much more involved, it's a service industry, and at the end of the day, it's dealing with human lives. So I think our adoption usually happens a few steps behind the other industries.
Thank you, Dr. Vishal, for giving a beautiful insight on AI. And I strongly believe that our students must be benefited by this response also, along with the other audience member. Now, my second question is to Mr. Niladri Majumder. Although Mr. Niladri, Dr. Vishal has touched upon the major areas of AI, but since you are in Toronto, so we would like to understand your experience from overseas point of view, that the things are the same or there are some changes. And if there are some changes, in which specific areas you feel that AI is helping the hospital industry, especially from Toronto point of view. And then what are the major specific therapeutic categories also you feel that they are covered there in Toronto through AI?
Okay. Hi, and thanks, Dr. Sandeep and Dr. Beri, for your insightful comments. So at the outset, I would like to really thank everyone for joining us this evening for a very pertinent conversation on artificial intelligence. And I think we all would agree with the kind of whoever is attending and the esteemed panelists that AI is really having a widespread impact on the healthcare industry at all levels. So yeah, so I'm just going to dive right in. So just to build on the comments of Dr. Beri and just to give some preamble to sort of the AI use cases on healthcare, I just wanted to share one excellent slide that I kind of came across yesterday, which sort of provides a framework of all AI use cases in healthcare. So this will give you a gist of what AI can do in the healthcare landscape. So I'm just going to share my screen. Just give me a few seconds. So I guess you would be able to see my screen. I'm going to go into presentation mode just to make it more clear here. Yeah. Yeah, so this is kind of this is a slide from the Center for Innovation and Impact from USAID. So what they had done is they had scanned around 500 plus use cases of AI, which is being implemented right now across the world. So what they have done is they have classified and stratified all the use cases into 4 different broad categories. So right from the top, we have population health, and kind of we have also a big segment of the individual health, which is sort of split into 2, sort of care routing and care services, and also the health systems piece, in which kind of the healthcare administrators or healthcare managers would be really interested in, and also the lastly kind of we have this pharma and medtech kind of things. Yeah, so as you can see, the scope of AI in healthcare can be really vast, and we can spend not only hours but days talking on AI in healthcare. But I believe, kind of for the sake of the session, I think based on the expertise of the esteemed panelists that we have this evening, kind of we are going to touch on some of the use cases that we see here in the slide. But just kind of drawing from my experience, working with some of the acclaimed EHRs like Epic and Cerner across the world, and also sort of implementing some of the data science implementation projects in hospitals like the Stanford University Medical Center, the Cleveland Clinic, and now a University Healthcare Network in Toronto. So I can actually relate to some of the broad themes that I see in the slide. So one, I would like to draw your attention to this dot 5A. So a lot of work is being happening, as Dr. Beri also mentioned, that on the clinical decision support area. So in terms of clinical decision support, kind of two AI implementations that we have done in the hospitals is we are sort of helping doctors to provide recommendations around the the electronic order sets. So when they actually place an order for the patient, so there is a kind of a recommendation on electronic order sets. And also we are trying to launch a best practice advisory alerts as well, kind of, okay, this patient is at high risk of XYZ, so you should kind of take into account. So sort of a risk profiling of patients, which is happening right at the point of care, and kind of our doctors love that. So one other area of application that I've seen is natural language processing that has really helped the doctors and the care team at large very nicely. So kind of this involves a sort of a speech to text. So doctors spend around, they say there is a statistic around 25 minutes of an hour of patient care just to document the clinic notes. So kind of we did a time study after we implemented this speech to text kind of natural language processing technology across the hospital, across University Healthcare Network, which spans around 1,500 beds and 6 hospitals in Toronto. So kind of, yeah, from 25 minutes, the time has been cut down on average to around 13 and a half minutes right now. So that is a big win for one of the AI applications that I've seen. And apart from this kind of clinical decision support, if I can talk a little bit about the health systems bucket. So this is where sort of hospital administrators would be interested in. You see point number 7B. So they are talking of the capacity planning. So kind of we really wanted to understand, and in our hospital we have done this. So we were actually planning for the ICU beds, kind of the post recovery and cath lab beds as well. Kind of people were not sure what would be the planning in order to the normal analytics that people would perform based on the historical data. We also applied some kind of machine learning algorithms to really understand the demand kind of in the next 10 to 15 years, so that really we could justify the investment that we are kind of going in. So this is one of the use cases that I've come across. And one more use case I can talk about in the pharma and medtech is the clinical trial support. So what we have done in our hospital, we use this Epic EMR systems. So they have this embedded kind of rules engine inside the EMR system, which can automatically filter out patients for a research study based on scanning the patient's chart. For example, if I'm a researcher, I want to launch a kind of a study, but I don't know in my EMR data how many patients would match my inclusion and exclusion criteria. So rather than really a blind matching, so kind of you just need to feed in certain criteria and the system matches and brings out kind of really the list of patients that you can talk to on contact. So this has significantly reduced the time that people used to spend contacting patients for research studies. So now out of in the earlier we used to contact around 80 patients for a research study. Maybe in the first week we are contacting kind of 40 to 50 patients with a success rate of 90%. So that is one another kind of win of AI as well. So yeah, so I talked about clinical decision support, natural language processing, and hospital infrastructure planning, which is covered in the capacity planning. And also, yeah, I think there's a big space of AI in the claims and coding space as well, and also in the resource management and resource mix. So we also started a study kind of a few months back in which we were trying to come up with a nursing resource pool. So that nursing resource pool would have nurses who can cover for the nurses on shift if they're sick or if they're kind of absent, or if they have any sort of unscheduled events. So we were not sure about the resource mix. So do we put 20 nurses into that? Do we put 40 or do we put 60? So we were not sure. And then probably AI helped us really to understand really the track record of nursing absences, unscheduled absences across the hospital, and really to give some insights into what could be the need of in terms of number of nurses in the nursing resource pool. So that is one kind of also use case for resource utilization. Yeah, I think this is pretty much in terms of my experience. So let me pass it off on to Dr. Narula.
So, thank you, Mr. Niladri, for your beautiful insights and the presentation which you have shown to our audience. So hopefully, it is going to help them a lot. Now, my next question is to Ms. Nidhi Goel. Ms. Nidhi, since you have a vast experience in payer and provider, so before we begin on the payer and provider, we would like to know. Yeah. I was just requesting you that in case if you can give us some insights about the payer and provider, because you are working in this space since last so many years, and of course for this the role of EHR plays a very important role. So I would like to understand from you, in case if you can give us some insights about the EHR, that is the electronic health record. Although from India's point of view, it is negligible, but from your overseas experience, if you can give us some insights, it will be really beneficial for us.
Absolutely, Dr. Narula. I think it's a very important question. Thanks for asking that. So I guess, as all of you know, US being one of the most advanced in the healthcare, especially when you talk about data, almost 96% of the hospitals, they have EHR system, one or the other kind. It could be one of the approved ones or like a non-certified ones. And almost 86% of the physician-based clinical practices, they are on each EHR. And having said that, it doesn't mean that all of them do use EHR. There are some of the systems which are still based off the paper trails. Now, the important thing is that how this was enacted, like how the government made sure that people are in compliance with using EHR. That's very important. And Dr. Beri actually mentioned a very important point that using AI is at an overkill in an Indian system. And I think that's a very good point, because at one point you're struggling even to provide the basic health facilities, and also making sure that the facilities are hygienic in condition, you have proper patient management there. And on the other hand, you want to talk about AI, which is definitely a lot of investment for hospitals. So when I look at it from that perspective, I think the way US does is like a strong implementation and a government interest is really important. So back in 2015, the Congress actually made a change, which was through the American Recovery and Reinvestment Act of 2009, where they made it sort of a mandatory to encourage EHR adaptation within the hospitals and the physicians. So when I say an act to be enabled, what it really means is that the government tried to encourage hospitals, which is basically providers, to use EHR. And they started incentivizing them. So the incentive was that they would give some kind of subsidy, or, if you adopt an EHR, you would get some kind of discount. And then the physicians who would not, they would be sort of, have a decreased reimbursement. And this reimbursement kind of practices more in the two products, which is Medicare and Medicaid products, which are more federal products in the US. So that's how the strong implementation and strong interest of the government really led to majority of the providers adapting to the EHR. Now, to answer your question, what is the relationship between payer and provider? And I have worked in 3 different countries from payer and provider aspect, in US and Canada and UAE, and in India, but India I was actually working in the healthcare. So my experience has been that it's a very strong relationship between the provider and payer. And I'll talk about the population management, because Dr. Beri actually covered a lot of good aspects of AI, and Niladri consumed a lot of the aspects on the practical usage. So the ones that I want to talk about is the population management. So if you talk about population management, over here in US, it's not just about managing disease, or it's not just about managing a member checks in and you're managing the total care. It's about the population management, how you cover the risk of the population and how you make sure that the cost is also covered. And AI plays a very important role in that. So the way we use data over here is that we consume a lot of EHR data and a lot of claims data, which is all the billing claims information, which is related with all the ICD codes and billing codes. And we combine that data with the social determinants of health data. And then we build predictive models, which is basically addressing the behavioral needs of the members, the risk profile of the members. A good example would be that, let's say, if I have to manage a population in over 60, and I'm looking at the members who are just diabetic, and I want to understand what kind of population risk management I can do. Now, let's say if I find there are a million population who are diabetic and in the 60 plus zone, and I don't want to invest in the entire 1 million population. So these AI models help you to identify the tip of the iceberg, that what is that 1 or 2% of the population where you really want to invest on and get the good returns. So that's really the key in here, that AI is important when it tells you where the risk lies. And not only risk, it is also prescriptive in nature. So we don't just say that, well, this is your risky population, go ahead and manage it. There are 3 steps further down to it where we say that, well, this is your risky population. We found the profile of this population. We also know if the behavioral patterns support the engagement of this population. Plus, what is the cost benefit in kind of managing this risky population over 60? So that's one very, like a use case of the AI, where you combine the historical data, their behavioral patterns, their social determinants of health data, and then combine this into risk modeling, and then use this risk into cost-effective solutions. And that is, I think, one very effective use when I look at from a US perspective that we have been doing here. I also want to comment upon the situation in India. So much I agree that AI might be an overkill. Sometimes I also feel that the bigger hospital chains, they have a lot of capability and capacity to use this AI. I have a couple of friends who are working in the bigger chains like Escort or even AIMS. And when I talk to them, they are sitting on the volcano of data. And this data can be used in so many good forms in the patient management, building predictive models. So if you are maintaining good health records of a patient or a member, you can actually predict the risk of a certain disease. You can build predictive models saying that what is the probability of a member developing diabetes, a pre-diabetic condition. You can also build predictive models saying that what is the probability of a pregnant woman having a high-risk pregnancy. Now, if you know that beforehand, you can actually work on these members and reduce your cost. So I think the intent is really important here, what we want to achieve out of this AI model. And there are various use cases you can develop based upon these AI models. And I'll pause to Dr. Narula for any other questions.
This is again, since medical fraternity has already adopted the technology, artificial intelligence and digital technology, but the full service window, which is the pharma industry, which serves to the medical fraternity, unfortunately, we haven't seen the adoption rate at that pace, which the doctors and the medical fraternity and from the medical fraternity. So can you tell us the reasons that why the pharma is a bit sluggish in adopting the change or the digital technologies and the transformation?
Okay, so about digital transformation, I think the answer lies in the question itself, right? So you said it is about when pharma's role is to serve doctors, then why are they not really adopting technology? And I think that is where the answer lies. The industry sometimes forgets that its purpose is to serve its customers, and its customers, by customers I mean the medical profession, right? So because they are the people who pharma reaches out to for their products to be sold and so on and so forth. So from that perspective, I think pharma has a couple of conundrums. One, because I'm reserving my comments to the Indian market, while things are different overseas. In India, the way pharma interacts with the medical profession is very different. So in India, being a hyper competitive, hyper cluttered market with so many brands and so many companies operating for mind share from all the doctors, I think it doesn't allow pharma to have a little bit of patience in trying to see the implementation or the results of an implementation of a proper digital transformation strategy. So I'm speaking strictly from a customer-facing perspective, right? So any investment that you make into digital is a transformed way of working. It's a new way of working, and at this point of time, that new way of working can actually bring to the surface a lot of risk, because you're not really having any precedence to gauge whether you will succeed with what you're doing or you're not. And the second thing is because of the competition in the market, the focus or the pressure on delivering results for the month and for the quarter. By results, I mean achieving the sales numbers for the month and the quarter. There is a tremendous amount of pressure on CEOs and senior leaderships within organizations. So with a combination of these two things, I think sometimes it doesn't allow, it doesn't give pharma the kind of risk appetite that is required to do something new. And at the same time, the amount of money or time that is required to be invested into, and the patience for to wait and see results coming up from something which you haven't done in the past is also, it requires a great deal of risk appetite at the senior management level. And at this point of time, and given the economic conditions, I don't think pharma has the capacity for that. Apart from that, I think the Indian market is more responsive to instant gratification, and therefore there are very, very clear ways in which or set ways in which the industry and the medical fraternity have developed relationships which have been time tested and are known to be delivering results. So asking senior leadership within pharma companies to move away from the time tested success to try out something new which might be more sustainable in the long run is still, it's a difficult venture in the pharmaceutical industry. Now, having covered the customer facing part, let me also say that pharma is extremely digitally matured as far as the back end of operations is concerned. So streamlining technology, using technology to streamline their operations from drug discovery to disease management to getting new products, being able to get or to predict R&D failure in a quicker way, reducing therefore the cost of bringing drugs to market, digitizing the whole manufacturing and the supply chain operations, etc. I think pharma has done extremely well, and there are many examples of this in the overseas markets. We have companies like Roche, GSK, Johnson & Johnson, Novartis, and so on and so forth, which have really used technology to rekindle or bring over or redo their entire R&D pipeline. Right? The productivity of the research and all has gone up tremendously because of the use of technology. So it's quite a dichotomy that while pharma uses technology very well in its back end, it really doesn't allow it to migrate to the front end of its operation, meaning the customer facing one. So the creation of value using digital engagement platforms or digital engagement campaigns is still really not understood at the customer end, at the customer facing level. So it's an interesting dichotomy that I enjoyed observing over the many years that I've been associated with the industry.
Certainly, it was quite interesting observation, Mr. Salil Kallianpur. Now, my next question is to Professor Marianne. Professor Marianne, I would like to understand from you that since technology, we know it is only an enabler, and as you have listened and observed to the medical people, also to the pharma industry people, also and they are the service window. Now contributing to because they are contributing in the healthcare, pharma, and hospital. So we have observed that the change is there, but the change is a bit slow. It is quite slow, and also to some extent it is not sustainable also. So from a change management consultant point of view, can you tell us that are there any cultural barriers or it is a mindset or an attitude which plays an important role that the companies are not going for digital transformation and they are not willing to adopt the AI which has to be there?
Thank you very much. Thank you very much for the interesting question and having me on the panel. I would like to share with you 4 parts of an answer regarding your question. And I would like to start with what is change all about? Not theoretical, but people are giving me answers when I ask them, what do you feel? What is change? What is your perception? Secondly, I want to share the journey of emerging process between 2 hospitals. I think it's quite an answer on your question. Secondly, let me trigger a little bit of the conceptual levels of all the listeners and our audience, because we are on academic level or with the hardcore CEO, so we can understand that. And the last, I would like to finalize a little bit of my story, my sharing experiences with some tips from my perspective, of course. Yesterday, I was in a board meeting and we were talking about cultural changes, and we were talking about all the implementation we have to do regarding new technology for, I think, 5,000, 6,000 students. And I told them, well, let's start from the beginning, because change is from within. So, ladies and gentlemen, you have a very good and responsible position, but what is your feeling about change? And the technical guy, he answered, ma'am, do you think AI can help me with my own behavioral change? And my answer was, sure. I don't know 100% right now, but sure. So what is change all about? When I asked a couple of students, because I'm a visiting professor, and they answer me, ma'am, change is the only constant in life. That's for guarantee. I said, that's a very good answer. Secondly, it's all about life. We are here maybe for an MBA graduation. However, we like to have also an MBA in life. And then I asked them, how do you get your MBA in life? Well, they answer me, don't be afraid of any change. Try to be ahead of change. That means learn us what we need to do, or what kind of tools we need in our mindset to anticipate on change or to embrace change. And they're young guys, between 20 and 24. Another answer was, let's jump all together into the unknown. When we hold each other's hands and we can support each other, we will overcome and survive the change. I think on society level, we had a huge change the last 3 months. A lot of people were 100% involved, and not only the healthcare sector. Every country rewarded their healthcare medical staff. And that has nothing to do with technology. Rewarding people, saying thank you. Is there any software program for that? Is it the same impact? I don't think so. On the other hand, when we try to define change without any theoretical perspective or approach, then it is quite fluffy. When you drop it, you don't hear anything. When you like to see it, you don't see it. However, you feel it. When there's a change needed, especially in the service-oriented industry, and there's no change, people don't feel very good about it. When the change is running around all the business processes, especially again in that service-oriented industry, people feel it every day. Sometimes they don't know how to involve, how to participate, how to anticipate on that. And that's, well, it comes to how can you learn that? The more changes you have experienced, the better you are in. But when it comes back to life and death, you will never learn it. You have to face it and you have to manage it. And of course, manage your own emotions. And that's an important thing regarding change. It's more in the intangible aspect of life. It's not tangible, it's intangible. So Watzlawick, and I remember 6 months back, that was on another university, 150 students in front of me. And after the guest lecture, I asked them and I told them, please listen very carefully and try to repeat. Sure. I know that you know that I know how you feel. Ma'am, say it again. I said, okay. I know that you know that I know how you feel. 3 ladies in front of the auditorium, they start laughing. And they said to me, ma'am, we know. Why I'm kind of referring to the statement of Professor Watzlawick, 1998, US psychologist. He said, when you understand those 4 levels in your mindset, then you have all the competences to understand and to lead change. For example, empathy, for example, imagination, for example, anticipation. It's still quite abstract, so let me jump a little bit into 2 stories. One is the merging story between 2 hospitals, big hospitals in the Netherlands. And they had, of course, the informal conversations already, because merging processes is like dating. And then you have to decide without AI, shall we marry or not? And then maybe after a good marriage, maybe 20 years, are you still partners or you have to explore the area of a divorce. Between two companies, it's the same. However, it's a little bit slow. It's more complex because we're talking not about two organizations. We're talking about maybe 500, 5,000 people with their own mindset, their own cultural background, and their own experiences in change processes. The first thing we did, ladies and gentlemen, medical staff, do you have a vision? Part A, yes, we have a vision. Other party B, and they were intent to merge, yes, we have a vision. And is there any consensus between your two visions, or do we have to explore what would we like to do in the coming 5 years, maybe 10 years together? Then the process of developing a vision. Are we going to do the right things? And are we going to do the things right? That's more or less a vision. And when you start exploring, but also developing a vision together in that merging process, I remember that one of the cardiologists, he came up front on stage and he said, my heart is beating for everybody and we are here for everybody. And then he received an applause. That was more or less the core of the new vision. Irrespective of the healthcare sector, it's one back and a very important step in the algorithm of change. When I talk about that algorithm, then it's a non-technical algorithm. In change process, you have also an algorithm. You can compare it with a recipe. When you have a recipe and you lock yourself a couple of hours in the kitchen, it's maybe a surprise what's coming out, or it is the same as the day before. Certain rules, certain steps you have to follow to achieve a certain result or an outcome. In change management, you have the same. So during that merging process, we try to find what is the algorithm of that particular merging process. Creating a vision, yes. Creating a strategy, yes. Try to have one slogan in which all the values and norms are involved. Call it a mission statement. Do we have commitment? Do we have commitment really on the personal level? When we take care of a patient, then we are personally involved. But when we have to be part or proactive or maybe passive during the journey of a change, for example, that merging process between the two hospitals, we also have a personal commitment. Are we committed, or do we say yes and we do no? That means we enter the area of resistance. If there's no resistance in a change process, believe me, it's not a change process. It's repeating the same, maybe a little bit different in color, or the chairs are a little bit different around the table, but it is not a real change which impacted people. And is it a change for the sake of the change? No, of course not. Don't waste your time. Within that merging process, two totally different hospitals, you have to develop that vision, strategy. You have to inventorize, is there enough commitment? And of course, when people feel the pressure of change, they fall back in the instinctive behavior. Maybe they only want to take care of themselves and not anymore for somebody else or the clients, because they feel I have to survive. And what kind of games we are going to play? And is it possible for a leader to break through those patterns, those games, and then we're jumping into the culture? Interesting is that Kashain, a psychologist, he said, you can divide the culture into 3 layers. One layer is outside. When I enter a hospital, I see very modern, white, green, or maybe blue. Then I receive my first impression of that hospital. Not only hospital, also an automotive headquarters, or maybe an airline with the headquarters somewhere in Delhi or in Singapore. That's the first impression. The second layer of the culture is, are we able to become aware of our values? And what is the ethics within our values? Do we have any communication channel to share the values? To give feedback because we don't like the norm set by person A compared to person B. That was the toughest part of the journey during the merging process of the two hospitals. Of course, they have values, but the standards and the norms were totally different. And can you negotiate about that? Can you negotiate about your own values? That's quite interesting. So that was the second layer. And the third layer of Edgar Schein, he said, basic assumptions. That's what is your right to exist? Every hospital knows what is my right to exist. But maybe you interpreted it a little bit different. Again, during the journey of the merging process, two complete different basic assumptions. You can track it back to the founder of the hospital or to the CEO or the team who are working there for 20 years. They have their values. They furnish the whole hospital. So the first layer is there. But the basic assumptions, you can read it in the nonverbal behavior. That's also a very interesting, however difficult part. When I compare this merging process with another merging process between municipalities, also in the West, the algorithm of the change is the same. Was there enough resistance? People committed? Enough competences? And was the leadership on the right time, in the right situation, with the right solution for the challenges you have to face during the implementation? When I compare it to another interesting implementation of a vision in the airline industry here in India, it's the same. So irrespective of the culture or the background or the heritage of a country, when people start in the implementation of a change, not for the sake of a change, but a very clear vision with a clear strategy, halfway the behavior is more or less of the same. Outside, no. When you're wearing a sari, because I'm talking from Bangalore, it's different than when you wear in New York your jeans. But remember the layers of the culture. First layer, the artifact. Second layer, norms and values. Third layer, the basic assumptions. The basic assumptions, how people behave, it's all over the world, in my experience, the same. Now let's come back to what kind of frameworks. Not too abstract, but implicitly, I was talking about competencies. And maybe you know the Daniel Goleman, he was talking about intelligence quotient and also emotional quotient. If you are aware of your own emotion and you can manage that, then you're more prepared for example, the competences of empathy. Empathy is jumping into the shoes of somebody else, not only your own shoes. Hopefully it will fit and you can walk and run a lot of miles in your life. However, what are the sizes of the shoes of somebody else? Can you understand that? Can you imagine that? Can you support that? So empathy is a major competence to lead change. Self-awareness, imagination, anticipation, and then the toughest one is scenario thinking. We all know in business what scenario thinking is. What if, suppose. But in change management, what kind of competencies you need as a leader, but also people on the shop floor, people in the front line. Think about healthcare in the last 3 months. Was it possible? Scenario thinking? No, everybody was surviving. So the time to reflect and to develop and to select any scenarios, no. I remember the Prime Minister of the Netherlands, Mark Rutte, and he said every day he was on television. Every week with his team, he was on television to update the people in the Netherlands. And he started with the sentence, I'm so proud of all the people who are working in the healthcare sector. But I'm also not at all proud that I don't have the experience at the moment to make decisions based on experiences, to make decisions based on data, because I don't have them. I don't have AI, which can help me to take the right decision, how many people I need tomorrow, how many ICs I need tomorrow. Do I have to collaborate with other parts of Europe because we are running out of intensive care facilities? The way he was talking to all the people in the Netherlands and part of Europe was not from an AI, was not from a political standpoint. it was a very intense human being way of talking, which relates him and connected him not only with the healthcare sector, but also with all the citizens. He was vulnerable, and he made the statement, I'm doing my level best to run this country during this, well, very unpredictable, but also horrible times. But I have to take decisions without any data, without any experiences. So that means when you know why and what and how as a leader, why do you need to change? What is the topic of the change? And how is the approach? How are people involved? How people are reacting or proacting regarding the change? As a leader, you need to know, and more, you need the experience on that. So the competence part, the context of why, what, and how. And I'm not talking about leaders. I'm talking about leading the journey. As we all know that sometimes, especially in the intangible areas of organization and in the service industry, there are better informal leaders, especially in emergencies, than maybe the formal leaders in the top of the hierarchy. And that comes back to what is your maturity, what is your mindset, and are you bold enough to face parts of life with or without AY? Now, what kind of tips I have regarding my experiences? Well, be prepared. Change is everywhere. Can you use AY to be better prepared for change? Yes, you can. And the question I received yesterday from one of the board members, do you think, ma'am, that we can develop an AY system to support behavioral change? I said, how many data you have of your culture? How many data you have of all the interactions? None. That means you have to start with, of course, collecting the data in the intangible way. Is then AY the best tool for that, the best enabler? We have to find out in Bangalore with 2 universities. So constant update, the state of the art of the culture. But we know when we enter any organization, especially the service-oriented industry, education or healthcare, we know every day we feel what the state of the art is of the culture. But we don't have the data in our system. My third recommendation and tip is, irrespective of the change, maybe you can anticipate it, maybe you initiate it, maybe you can foresee it, always train all your people on the intangible and the competences, that they are prepared, that they don't fall back, oh my God, the only thing I can do is survive. No, that they embrace the change, maybe in a negative way, maybe in a positive way, but they don't ignore it and they don't run away. That means constantly training. Mentor the leaders. If we think that the top in every organization can lead change, my answer is no. Depending on their maturity, depending on the mindfulness, depending on their mindset, and depending on can they step into the shoes, every layer in their own organization. And that means the MBA in life. When I start this little story about what is the definition of change, when I asked the students, and one of the students responded, ma'am, I want to learn an MBA in life. And the combination, MBA, with all the real hardcore knowledge, but also your experiences in life, I think that combination is the best one to lead change. So I wanna finalize my story by, I know now that you know that I know how you feel now. Thank you very much, Dr. Sandeep. I really appreciate you invited me.
Thank you very much, Professor Marianne. Dr. Vishal, since Ms. Nidhi has to leave early, if you allow me, I would like to take 2 quick questions from her because my students are asking 2 questions. So just, Ms. Nidhi, are you there? Hello? Miss Nidhi, are you there? Can we take the questions from you? Probably she's not there.
Yeah, I think she's on mute. Maybe somebody can send a chat or something.
Etisha, can you check for Nidhi? In the meantime, then I'll take up the question with Dr. Vishal. Sir, so far we have discussed also, and with respect to the changes, now since we have already discussed about the change management, and you are the CEO of the hospital, obviously it is a big challenge to you. So, how you would like to recommend the change? How you would like to recommend the change from the organization and the workforce point of view?
Sure. So I think Professor Marianne, she summarized it pretty well. The change, whether related to AI or otherwise, change is tough, no matter where it is. So now if we look at this specifically, now, would we, if we were to look at the impact of AI on healthcare and the jobs, so would it be fair to simply view it in two dimensions, which is, will it add jobs or will it reduce jobs? So honestly, I don't think that's correct. It's not only about adding or reducing. The big thing which we need to focus on, the work itself will change. So it's not only a plus and a minus. It is also that the style of working is going to change. So how's that going to happen? How do we think AI can actually change the kind of work we do? So one is, like we have already covered, it will remove or minimize the time spent on routine and administrative tasks. So there are so many tasks in healthcare organization which are just routine and administrative, which can easily be done away with. That is where technology, and more specifically AI, can actually play a role. Two, it can augment the range of clinical activities and help the practitioners access information. What this does in turn is it improves patient outcomes and results. So for every healthcare organization, I think that's the ultimate goal, to improve the patient outcome. So AI can play a role in that as well. Three, which we are already using and which we said is also very common, is it improves the speed and accuracy of diagnostics, of radiology, of pathology. What that in turn does, it gives the clinician the report much faster, helps in quicker decision making, and again links to the better patient outcomes, which I just spoke about before. Now, what all this will do is it will bring new activities and new skills into the sector. So ultimately, this has an indirect rub-off effect onto healthcare education as well. When all this is happening on the ground, your education, which is a few steps and where the output is coming from, is also going to change. So you're going to have the education, which currently is predominantly, at least in the medical part of it, is predominantly rote learning and just memorizing things. That's going to change as well, because you're going to have this whole technology and this interface happening as well. So there's going to be an impact on the health education part as well. Then again, there's going to be a big leap in terms of these digital and these AI skills are now going to need to be incorporated into all your healthcare processes. So it's not only the physician, their style of doing consultation is probably going to change. It's going to be the person at the front office, the way he's going to interact with patients is also going to change. So AI is then going to find its place into everything across the value system. And of course, one more effect is that also all this put together is going to create a need for a new set of professionals. So today, I'm sure, like Nidhi said, in the US, it's much more evolved, and probably most large healthcare organizations would have these positions. But how many healthcare organizations in India have, let's say, an AI engineer? How many of them have a data analyst? It's just nothing. So as management, like we said, when we are battling with a whole set of entirely different problems about access, about affordability, about maybe managing costs or ensuring viability of the organization, how do you actually prioritize, or how do you think? We never think it's a worthwhile investment to invest in having a resource for handling data, or a resource on maybe someone who's going to look at AI. So I think ultimately, when AI finds its place into all of this, that is also going to be impacted. So all these things put together are how this is going to really impact the workforce. And of course, then you would need to bring about that change. So coming back to the overall thing, that do we think it's going to reduce jobs? People are always very skeptical that with AI coming in, we are going to lose jobs, we are going to cut jobs, people are going to not have a job. But actually, look at the other end of the picture. We are facing such an acute shortage of manpower, medical manpower, whether it is doctors, whether it is nurses. I just shared those statistics initially. And even no matter what sort of pipeline, at least in the Indian context, whatever pipeline we create, that shortfall is not getting covered in a hurry. It's not going to happen for the foreseeable futures because our medical education colleges, we just cannot produce that many medical graduates. We just cannot produce that many nurses. And then we come to the challenge of brain drain and actually retaining people in India. They currently all move out. So that's not happening in a hurry. So why not we look at it in a way that AI can probably help plug this gap. So today, if AI can do a job where I needed 10 people perhaps earlier, I don't need those 10 people. Ultimately, this is going to solve the manpower issue which the healthcare industry is currently facing. So that's again a very important thing. So now, how would it really change the job of a healthcare practitioner? So like we said, your routine and administrative work is taken care of. So nurses, interestingly, most studies show that nurses are spending today on an average only 40% of their time dealing with patients. So actually a nurse is meant to only deal with the patient, only take care of the patient. But today, and I'm talking of India. So in the US context, in fact, there are numerous studies and numerous comments where they say that these EMRs, EHRs are actually, ironically, which are meant to reduce the burden. But today that's also become a pain point for people because for doctors, they're saddled with so much of administrative and data entry work which goes into the EHR. So today that's a bit of an irony. So in India, where we don't really have that much of EHR adoption, but even here, the nurse is only spending 40% of her time with patients. So if AI could help play a role in that and the nurse could spend much more time with the patient, isn't that ultimately something that is going to ensure better outcomes? So definitely it will. Then it's going to also support your clinical activities. So like we said, your decision making at one end of the spectrum, but even otherwise, your clinical activities are all going to be impacted. There's going to be easier access to knowledge because when you have a set of symptoms, you actually know what your diagnosis can be. Today, you have AI tools where actually at the click of a button, you have all the data a doctor could require about disease, which would otherwise require voluminous books, which through our medical education, we've all studied those books. Today, all of it is available at the click of a mouse. So that really would revolutionize the way things are handled. Patients can also be empowered. So today, like I spoke of the remote monitoring tools. Today, there are patients with these. You have a simple example is a smart band, where today so much of data is captured in a smart band. The patient comes with all that information already with him, which was not the case earlier. He would be clueless about what his BP is, what his pulse is, what his trends have been for the past few months. Today, you've got gadgets which can even monitor sugars with the patient in his home. So I think that's also going to play a big role. So ultimately, AI is going to significantly impact the workforce, provided we look at it positively. We do not look at it as a threat. Now, I would also like to take a minute to make a special mention because I am a doctor myself. I head an organization where almost 60% of my employees are doctors. Now, traditionally, doctors have been very resistant to AI or any sort of thing which would step onto their toes of decision making, because ultimately the way healthcare is designed, it's the doctor who's ultimately in control of most of the situation. It may vary country to country, but I think to some extent that is the case everywhere. And the doctor ultimately uses his judgment, his clinical acumen to ultimately decide what he's going to do for the patient. So why is there so much of resistance? Why is it that a doctor, they are not very keen to adopt AI? Now, one interesting sort of thought I came across when I was researching on this is this whole black box theory. So what typically happens with AI is, which is an interesting analogy, it's actually like a black box because there's a whole lot of data which goes into the AI engine. It picks up data from hundreds and thousands and millions of data points, and it comes out with an output. So it'll come out and tell you these are the symptoms. Okay, this is what the probable diagnosis is. But what it doesn't tell you, and simply because the volume of data is so high, it doesn't tell you how it has arrived at that conclusion. No, so for someone from a medical background, for doctors who have, we call it evidence-based medicine, everything is based on evidence. So if I say this could be typhoid, I say it because of these 3-4 things. Here, what happens is the data is assimilated and ultimately there's just an output. So this whole gray area where, and there's no way any human can actually verify how that engine has calculated that and how it's come up with that. So that bit of a gray area is one reason where I think doctors are very skeptical, because simply they can't put their finger on it. They when they take a call, they have in their mind, they have rationalized how they have arrived at that decision. Here they can't do that. That control in a sense is taken away from them. put in the hand of a machine, if you may call it that. So that's somewhat unsettling or unnerving. And again, most of them think that probably their role is going to diminish. So today in radiology, we are seeing a big discussion whether AI today, there are so many examples where they can analyze images and they can come up with probable diagnosis and reports on CT and MRI scans much faster than a clinician could. So is it that going down a few years from now, you won't need a clinician? Could a AI engine or a computer do the diagnosis itself? So again, probably not. That's not going to happen. The right way to look at it is that this is probably making the job of a clinician easier. So it should actually make his work easier. It should enable him to arrive at a diagnosis and give reports faster. So if you look at it that way, then there probably isn't really a threat in that sense. So I think the way to implement this change is you've got to first understand that it's only a value add. It's not going to threaten anyone. It's going to improve the productivity. It's going to improve the patient outcomes. And then your whole process of implementing an AI project or actually bringing about that change on the organization is going to be centered around this. Once that's done, I think then it becomes a little easier to sort of improve the adoption across the whole spectrum.
Thank you, Dr. Vishal. Thanks a lot. Nidhi, I would like to understand from you, because the students are more keen and interested to know, because since you know very well that AI is driven by data science and machine learning. So according to you, which part of analytics you as an expert will recommend to our students, whether it will be descriptive, predictive, or prescriptive? And out of these three, what are the major techniques they should learn, and with which softwares? And the second question, because you are leaving early, so we would like to, the students are keen to know also that as per your experience, what type of skill sets, the business skills as well as the non-business skills, they should acquire so that they can become a proficient data scientist.
Thanks, Dr. Narula, for asking this question, another important one. So you're asking two questions, the technical aspect of the skill sets that's needed to be a successful data scientist. And then the other part is like the softer skills that you call like non-business skills. So essentially, when I do hiring in my team, I'm looking for three important skills to be a data scientist, which is I call as 3I. I want them to be innovative. Like this field of data analysis is something where you can't do your analysis if you're not thinking out of the box. So you're given a question and you get people from different fields. They don't have to be necessarily from a healthcare background. They could be finance, they could be management graduates, they could be in pharmacy, they could be actually dentists or doctors. So one thing common that I'm looking for is innovation. They have to be thinking very creatively. So to answer any questions, they have to think, what are different aspects of this question that can lead to an analytical value? The other I am looking for is inquisitiveness. As a data scientist, you have to be very, very inquisitive. So if you come across a question, you can't just sit and take a question because there is a question for you and that needs to be answered. You have to make several questions out of that use case or a problem statement. You have to go out to the business leaders and you have to go out to your clients and asking questions like, why do you think it's a problem? If it's a problem, then what is the data point that you support? Is it like a legit question? Do you find other data points that supports a problem statement? So being curious is like the key in here, along being very innovative and creative. The third I'm looking for is like investigative. So for me, the analysis or being a data analyst is more like a detective in the world of the data. You want to understand that data is just data. It's numbers and it's all the data in kind of, numeric forms that you're going to analyze. It would not make any sense if you don't utilize your intelligence to understand that what aspect of this data would make sense. And I'll give you an example. So, and I'm giving this example from an Indian healthcare aspect. So Government of India has a lot of programs. They launch programs to take care of the mothers. They launch programs to take care of the elderly. There are adolescents kind of program. The important thing in here is that you don't want to just go and reach out to the million of population saying that, well, since you belong to the mother age group or the age group of the pregnant women, you are a part of this survey or analysis or an intervention. The key in here is that you need to question what are you trying to do. And that's where the data can help. So if you have data points, you need to understand that you're not going to reach out 10 million people in the maternity and child. out of those 10 million maternity and child population, you want to risk profile them, that which of these members actually need care. So some of them would be really in a good health zone and they really don't need any kind of mentoring or guidance from the healthcare workers. But there are definitely some of them who do need. So it's like really looking into cost effectiveness, how much investment you want to make towards getting that risk transformed or translated into savings. So that's important. So I will repeat these three I. You have to be innovative, you have to be more like an investigative person, and you have to be a curious person. The skills, the technical skills that I'm looking for, especially like in the world of the data science, if you can learn SAS is the business word nowadays. SAS is very powerful tool. It can turn billions of rows into very meaningful information. Along with that, R and Python, which is readily available nowadays in a lot of universities, is something you want to try your hands on. R is a very easy language. And then as compared to SAS, you can definitely learn an R and Python much easier than you would, invest time in SAS. And SAS is actually an expensive tool as well. So those are the technical skills, I would say, and the softer skills. The other aspect I wanted to talk about was the consultative piece. So as a data analyst or a data scientist, you just don't want to produce reports. It's very important that you build the loop, you close the circle. So you have a problem statement, you identify solution, and then you talk about the implementation. That's really the key in here. So a lot of times what we do is we build solutions which are very fancy in nature. You can go out and present your predictive models and say, hey, you know what, I can actually cut down 10% of your cost or 50% of your cost if you use a predictive model. The thing that lacks in here is how do you want to save that 20% of cost that you are prescribing or you are suggesting in your predictive models? And that's where you need to be very prescriptive in nature. And I'll share the example. So when I say you want to go out and have an intervention for maternity and child population, and you go to, let's say, government with the proposal that you have identified a predictive model and you have 1 million population that you want to manage. Now that's good. You have a use case there. But how about what is to be managed? That's important. So let's say if you want to carve an intervention, which is an app-based intervention. So how many of the people actually use a smartphone? Did you test the data on that? And that's where you come with an investigative approach in data analysis. You want to understand that not many people use smartphone. People are still on landline, or sometimes they don't even have a phone. So if you start an intervention which is more of like a smartphone based, you are setting up yourself for a failure. So that's being more prescriptive in nature. Then you want to identify what do you want to impact upon, what is the risk. So in maternity and child, if you have historical data to prove that maybe the first delivery was the member was in PET, or maybe there were some risk factors. Maybe the gestational diabetes was one of the factors. So you would want to consider that in building your predictive models to assess the risk of the members and identify that of those 10 million population or 1 million population you've identified, which are the members you're going to target. And that's really important. And I'm giving these examples to tell you how you have to be innovative. At the same time, you have to keep your investigative hat always on, trying to find and close the loop that this is your risk profile and how I'm going to manage them, how is an important question. And then also, what do you want to assess on? The things that you call as healthcare measures or the key performance indicators. So if you're launching an intervention, or in hospital sector, if you're managing productivity for nurses and physicians, or you're trying to build models in the field of clinical decision making, the assessment is very important. Like, how would you assess that these models really worked or not? And did they actually had an improvement? An improvement could be in many ways. It's just not a cost improvement. It could be a quality improvement. So let's say you're trying to assess that, did the hospital increase revenue? Did the hospital increase customer satisfaction? So you have to close the loop by giving this feedback solutions. You develop predictive modeling, you incorporate AI, you plan an intervention, you have the key performance indicators, and you have the feedback mechanism, again, going back and developing your intervention. That's all I had, Dr. Narula. Back to you.
Thank you, Ms. Nidhi, for a very, very comprehensive and elaborative answer. I think that the students must be benefited, and we all are highly grateful to you that in spite of your busy schedule, I know that you have to leave for your work and you have to start your day. So, but we are highly grateful to you that you have paid your valuable time. So from the bottom of my heart, a big thank you to you. And needless to say that in the evening when you will open up your LinkedIn and Facebook, you are you will be flooded with a lot of requests from our students.
I'm looking forward for it, and it's a pleasure. The pleasure is all mine. Thanks, Dr. Narula.
Thank you. Thank you very much. Thanks a lot for sharing your time to us. Thanks a lot. Have a nice day. Yeah. Mr. Niladri, we would like to understand also from you, because your experience is quite high. So we would like to understand that how AI will improve the operations efficiency, cost reduction, and the quality of care.
Right. Yeah, so kind of thanks, Dr. Sandeep. Yeah, so now that kind of we heard a bit about kind of the change management and the skills that we need really kind of to get into AI and data science and analytics, this kind of industries, right? So this is kind of really the whole goal of AI, as far as what I've seen, is really to improve the patient care and make it safer, faster, and cleaner. Right. So right from the patient care standpoint, and really from the hospital administrator standpoint, as we all understand, really we are looking for tools, not just AI, kind of also tools that will also help in cost optimization and resource planning and infrastructure expansion and stuff like that. So yeah, so kind of just to give the audience a flavor of how a AI tool would look like when it is kind of implemented in action, I've got some slides kind of to share to the audience, and I love slides, so that kind of gives you a flavor of what's being done in the hospital. So let me share my screen quickly, and I'm going to give you a couple examples of where things are being implemented right now. Yeah, so I think you see the slide. Okay. Right. Yeah, so this is one use case that actually we implemented the fall of 2019. So here is the story. So kind of so the chief of ED comes to the data science department and says, hey, so we are having an unexpected workload in the ED, and I'm having challenges to plan my staffing around it. So I don't know how many triage nurses should I place at a certain point of time, how many residents should I have working in the ED, or things like that. So they were not sure, only because kind of they don't know. And probably in certain parts of North America, the flu season is a very high peak season, which starts from sort of October, November, and runs up till April or May. So this time there's a huge surge in ED admissions, right? And it is very important for health systems to plan and to know kind of how much or how many patients are they going to see in the ED. So now this is the dashboard that we created out of a machine learning algorithm. So this gives you a sort of a predicted amount of patients, number of patients that you are going to see in the ED, and that's based on certain timestamps. So it may be 3 days, 7 day, monthly kind of stuff, right? So what you see is a 3-day view out here. So you see kind of this is a dashboard developed on a tool called Microsoft Power BI, but at the back end, there is a sort of a machine learning algorithm which is running behind it. So what this Power BI dashboard does is it every day, it gives you kind of predicted amount of ED patients that you are going to see in the hospital. And this is kind of reflected in a big TV screen in the ED, so that the patients, so that the nurses know and the ED manager knows that this is the number of patients that I'm going to expect. Now, if I can draw your attention to the below, kind of the patient arrivals block. So this is really very important, that this has helped people kind of this, you can see the predictions for January 2nd, 3rd, and 4th. And there is a small arrow in next to the January 4th, which means that this is a high volume of patients that you are going to expect on January 4th. And this has helped people really to plan the resources around this. This is really the value add of the AI. And I've just listed some few details. The accuracy of the model is not 100% as we would expect, only because we started the model based on 20,000 patients data, but we are sort of training the model to make it more accurate day by day. But this is the data from 2019, but 94 to 96% was the accuracy of the model there. So this is one of the case studies that the value that we all heard from our esteemed panelists is really important to understand the value. It's not always cost. It's actually improvement in patient waiting times. It's actually ability to sort of align the resources as per the needs. This is one of it. And the next case study, so this is sort of a bit in the clinical treatment area. We actually implemented a deep learning model in the general internal medicine department, right? So there we saw, and probably we heard from the doctors as well, around 1/10 of the patients who are admitted there either go to the ICU or they sort of die at the end of this. So that is a sort of a historical data. So now what doctors and what the chief of general internal medicine wanted is to sort of a risk profiling of the patient and sort of an advance notice of that, probably if this patient, XYZ patient, what are the probabilities of this patient to be transferred to the ICU, or maybe chances of death are high. So what happens is when we implemented the deep learning model, and this was a very complex project we implemented for 1.5 years. Now I'm glad to say that the overall accuracy of the model is 98%, and there are some technical stuff, for example, area under curve. So I'm not going to go to the technical details, but really the value of the model that we experience is at the point of care, so this functions as a clinical decision support when the patient is admitted to the GIM. Based on all the notes and based on the historical data, the system tells you what is the risk of this patient being transferred to the ED, not the ED, the ICU, and what is the risk of kind of maybe the death based on the data as well. So this is one of the models this is something which is work in progress at the moment, but we wanted to really predict the hospitalization peaks based on your sort of influenza related admissions. As you can see, this is just based on simple historical data. This is not AI, what you are seeing in the slide right now, but the whole point is really to predict the peaks in the hospitalization so that the unit managers, the ED managers, the nurse managers, they can plan their resources around that. And the waiting time of the patients also would be less, only because this would make an efficient patient workflow. So yeah, so these are some of the very quick models I wanted to share. There are plenty of that, but this may give a flavor to the audience that how does AI actually look like in real life. So this is I wanted to kind of share, and I'll pass it on to Dr. Narula.
Sure. Thanks a lot. Thanks a lot for sharing your inputs on this. Now, my next question is to Mr. Salil Kallianpur. Hello. Mr. Salil, are you there?
Yep.
Yeah, Mr. Salil, can you briefly tell us that what digital strategies companies can adopt, especially in this COVID period, to serve the medical fraternity, so that they can enhance the customer engagement as well as experience also, because it is a good time to go for all type of digital experimentations.
Yes, agree. And I think a very important lesson that pharma has learned during this time is that there is a very less amount of customer information that is available with pharma companies. And if you want to enter a service model, and if you want to enter a service industry in the sense that healthcare is a service industry, pharma doesn't look at it as a service industry. Pharma's approach to this industry is of pushing product, right? Pushing their product information, making sure that their brand gets prescribed by their doctors, and so on and so forth. Now, that has essentially created a very big gap in pharma intelligence about a lack of customer intelligence, no insights into behavior, very little understanding of what customers want, what doctors want, and what they don't want, etc. So when up until March of 2020, it really didn't matter much because they had hordes of sales representatives going out and talking to customers, and just by being there, showing up and detailing your product, doctors still had a certain what we call in marketing parlance as a share of voice. And so pharma maintained a pretty high share of voice, which essentially is just showing up and detailing your product to doctors. When this went out of the window with the forced lockdown in March, that is when pharma realized that they really had no alternative. They really didn't know how to use alternate channels because they were not really matured enough in using digital outreaches towards customers. Second, even if they wanted to, they really didn't know what to do. And that explains why we saw a herd-like mentality, where one pharma company that saw some limited success with webinars prompted the entire industry to get into the webinar bandwagon. Right, and at the end of the day, what doctors realized is that they have more webinar requests coming in from pharma the number of patients that they actually see in a day. And that was actually, it backfired after a certain time, because the kind of content that would go on the webinar, or the kind of webinars topics that were set up and all that, really didn't match with the expectations of the doctors, or they were not interested in listening to branded communication or something like that. So, I think from that perspective, understanding customers is a very, very important part of it. I think pharma is getting it now. It understood that they had woefully little understanding about their customers. Their marketing plans were based a lot on assumptions. There was a lot of my feeling versus your feeling sort of a thing inside marketing plans. There was very little evidence-based management that was really happening. So that, I think, is a very strong positive. And once pharma realizes and understands their customer sets better, I think from there comes the answer on what should we use as digital strategy. Because I whenever I speak to my clients, one thing that I always tell them is to read an article that George Westerman wrote in the MIT Sloan Management Review in the October issue of 2018 or 17, I think it was quite an old one, which actually says that your organization does not need a digital strategy. And most of my clients, it's a jaw-dropping moment for them, because they come for a digital marketing workshop, and the first thing I'm telling them is that your organization does not need a digital strategy. The point that I was trying to make is that you don't need a digital strategy, you need a strategy. And if you have a strategy, it emanates from your brand. And if you know that, it emanates from how I can serve my customer. So you need to have customer information first. Then comes all your digital angles. So now I think with pharma having no other option but to reach out to their customers on through digital channels, I think they've realized this. The penny has dropped, and so customer now companies are actually doing a lot of work in trying to get this data, trying to understand their behavior shifts, their customers' attitudes, behaviors towards their brands, molecules, therapy, whatever else that is required. And I think over a period of time, what we will see is a much sharper sort of a marketing plan emerging from pharma companies, which will hold the context of the doctor as the most important thing, the context of the discussion that the doctor sets or the customer sets as the most important thing. And then they will build content around it, and then think about what channel to use to reach these doctors. So I'm quite optimistic about the future, and I think pharma is going to do well by making that one big change in their thinking, in their thought process, that is to move from a product-oriented point of view to keep the front and center of everything.
Thank you, Mr. Salil. Thanks a lot. Now, I would like to have a quick Q&A session, because there's a tremendous amount of pressure on me that I should take on the question and answer, because audience are getting desperate. So there is one question to the esteemed panelists. What should be the study field or course if I want to enter into AI, into healthcare and medicine after doing MBBS in India? Maybe Dr. Vishal Beri or maybe Niladri, if you wish, you can answer. What should be the study or field? What should be the study field or course if I want to enter into artificial intelligence, into healthcare and medicine after doing MBBS?
So I guess Niladri would be the right person to answer that.
Yeah, so I can just take a first stab at it, and then maybe you can add, Dr. Beri. Yeah, so kind of, and I'm not an MBBS, just for the background of the audience. So I've just done my kind of post-graduation from IIHMR. So I can tell you my story, and then probably that might kind of sort of leave some kind of really cues to it. So I have done a kind of a post-graduation course in Masters in Health Informatics with a sort of a specialization in artificial intelligence. So just to be clear on my role, so I really manage a team of data scientists and kind of a data analyst to get AI implemented across hospitals. So I am not a data scientist, but really to be a data scientist, you need to have sort of a kind of a background in math or stats, as I hear from many people from my team as well. But yeah, so there is also a greater role in sort of implementing of AI. So it is not enough if you build the model, you really need to do that implementation, the change management and the requirements gathering and stuff like that. For this entire gamut of activities, you need somebody who understands AI from a healthcare perspective, not so from a technical standpoint. So there are plenty of courses out there which can sort of give you a flavor of AI. And it is also important, as if you know the kind of the standard terms and technical, it's not important that you have to build the model on your own, but it's important that you have to manage the team based on the knowledge and understanding that you have. So just to wrap that up, yeah, so I feel kind of if you are doing something like from IIHMR, and then you can top up with your some sort of courses like kind of healthcare IT and analytics. In these days, there are plenty of courses that will help you learn and grow. And one more thing which is very important apart from their education is to find some kind of relevant experience. So the way that I sort of diversified from hospital management, hospital operations management to hospital analytics is I got a chance to work with Accenture in the healthcare analytics unit, and that gave me an exposure to understand what happens inside. And then gradually I built on doing some courses and stuff like that, and that led to where I am today. Yeah.
So you mean to say that the initial course of doing an MBA in health and hospital eventually lays a very strong foundation?
Yeah, that's actually absolutely correct. So that gives you a foundation to understand the domain knowledge. That's really very important, only because if you're managing a team of data scientists, they will really know or speak the language of stats or mathematics on the modeling science, right? But in order to implement the AI in a hospital setting, which is a complex hospital setting, you would need somebody who understands the nuances of working in a hospital, understands the workflows in the hospital. And that's where people like us come into the picture. Right? So, okay, here is a model, but how do I implement it in the ED? Who needs to be the kind of key owner of the model? How often should the model run? And probably how are people going to get value out of it? That's where kind of your sort of competency comes in. Yeah, that's what kind of I've observed for myself. That's my story. So, yes.
So, Dr. Vishal, you are a medico and a management professional also, because you have done your MBBS and MS, and then ultimately you have done your MBA from ISB. So how you would like to respond to this call? Because somebody has done MBBS and is keen in AI sector.
So if I was to put it differently, so one is it is not mandatory to do an MBBS to get into this field. On the contrary, the prerequisite actually is engineering, statistics, and that sort of stuff. Having said that, in today's time, once you have a basic degree, even if it is MBBS today, there are several opportunities to get into later. So whether it is consulting through the consulting route, whether it is through the experience route, like you said, so that could be a way. So if right at the start of your career, you are clear that this is what you want to get into, then the MBBS route is probably longer, tougher, and not necessarily better. Then you have other options to do it. But on the other hand, if you've already done an MBBS and then you still feel that you have an interest in this part of it, I'm sure there are enough ways to really get into that bandwagon, even after an MBBS. So if after an MS, I could do an MBA and get into this track, I'm sure MBBS is a good 5-6 years before that. So it's definitely possible.
Okay. So there is another question which, although it is addressed to Ms. Nidhi Goel, but maybe any of the panelists can respond. That I'm interested in healthcare AI. I have 10 years experience in healthcare quality and operations. So what is suggestion on this? I'm very much confused. And what are the courses available? Niladri, in case if you would like to respond.
Just let me unmute myself. Okay, I think, yeah. So I think it's actually really important to understand the roles that are out there in the market, kind of if you want to get into AI. So one of the roles that everybody of us knows is a data scientist if you want to get into AI. But apart from a data scientist, there are plenty of other roles that kind of one would need in order to form a data science or the AI team. So for the team that I have in my hospital, so there is a range of roles, and I can kind of briefly touch upon them. So we have data scientists, we have data analysts, we have change management experts, we have project management experts. So all of these people form this data science group. So now if you are looking into going into AI or data science, so one thing we have to clear is if you have this hospital experience, so you need to aim for one of this kind of non-technical roles, I would say, so that you would means aspiring to a data scientist is good, it's great, but it is only great if you have a really mathematics and stats background, right? So, but kind of if you are aiming for a change management consultant for AI, and if you are aiming for a project manager for AI, if you are aiming for a data analytics manager, so all these are roles are very closely linked to AI, but they are not super technical. You don't need to be a data scientist, but what you need to know is kind of the basics of healthcare, how healthcare functions, the ecosystem of healthcare, and a bit of management, for example, including change management and project management. So yeah, it's very important to research the kind of roles that you would like to. So it is a research for the part of the students as well. Kind of research the kind of students that they're out in the market. People research the kind of roles that they're being hired for, and try to understand what those roles need. So yeah, and it is a myth that if you want to get into AI, you need to be a data scientist all the time. But there are different roles as well. Yeah, just so I wanted to make that point here.
Thank you very much. Now, my question to Dr. Vishal Beri sir is, sir, the question which we have got in the chat box is to go for clinical data management. What course they should pursue?
So again, clinical data management, to the best of my knowledge, in the conventional medicine track, there is no such option available. My guess is, again, Niladri would have to pitch in, but my guess is this is probably one of the subsets in the health informatics, the data science, that in that piece. At least, like I said, the health track is pretty clear. It's an MBBS. We still have those same conventional set of post-graduation options, and that's about it. So these are all relatively newer things which are coming on the horizon. So my guess is that this is probably clinical data scientist is again one of those subsets in that whole spectrum which Niladri was speaking about.
Okay, sir. There is one more question which one student has asked from the clinical application point of view. Can AI solution demonstrate clinical application that supports primary, secondary, and tertiary prevention?
Primary, secondary, and tertiary prevention.
Prevention, yeah.
So yes, so we like I said, the piece where is this whole remote monitoring, where today patients are able to monitor their health. So in a way, what is tertiary and what is secondary? That's when the patient has to come to the hospital. Today we've created this entire opportunity where we do not necessarily need to have the patient coming to the hospital. So one good example is we still have a system called Holter monitoring, which is basically to monitor a continuous ECG of a patient. So what earlier used to happen is the patient comes to the hospital, you take an ECG, that's it. But there are times where you want to monitor his ECG over 24 hours, over 48 hours. So what this Holter monitoring would do is exactly that. It is a box which the patient wears and goes home that keeps recording the ECG continuously. But then he needs to come back to the hospital after, say, 1 or 2 days, and then that data is downloaded and we can actually see what the trend is. I'm sure now going forward, all that is going to happen remotely, and it's already happening. Today, you have smart bands which can monitor your ECG, which can monitor your pulse, which can send real-time data to the doctor sitting in his room. So, for primary, you don't. So in a way, this reduces the load on the hospitals because you don't need to really have these patients coming to the hospital. You only pick up the ones who actually require medical care and they come there. So definitely it has an impact. The other end is also your telemedicine and things like that, where in remote areas where there is no access to healthcare, no access to doctors. Today, sitting in a tier 1 town, the doctors can actually review patients, they can actually consult, they can see their reports, they can prescribe medicines. So all of this is in a way impacting the whole primary to tertiary spectrum of healthcare.
Thank you, Dr. Vishal. Thanks a lot to Mr. Niladri Neil also for sparing your valuable time, and to Mr. Salil Kallianpur and Professor Marianne J. We are highly grateful to you that in spite of your busy schedule, you have spared your valuable time. Although there are a few other questions, but we would mail these questions to you, and then finally we will respond the answers also to the attendees. So I'm highly grateful on behalf of entire IIHMR family. A big thank you to all of you, the esteemed panelists, for sparing a valuable time and enriching our wonderful audience with your own learning experiences. So thanks a lot once again, and wish you all a good night and a good evening.
Thank you.
Thank you. Thank you.
Thanks, everyone. Thank you.
Thank you. Thank you.